The ability for us to connect to a veteran wherever they are, and really whatever the circumstance, allows us to provide care at a time where it could really be needed. So for example, following Hurricane Harvey, when the Houston clinics were very short-staffed, we were able to come in and we were able to use VVC to see patients on the ground in clinics in Houston. And I saw a patient who was being treated for an infected foot wound, and he had been on some antibiotics that hadn't been working, and because of the hurricane hadn't been able to follow up to tell his provider that these antibiotics actually weren't effective. So as he was evacuating his house, he found himself in waist-high floodwaters, very dirty waters, and he noticed that his foot over the course of the next few days was hurting more and more. And this was particularly concerning to him because he was a caregiver for his wife, who has advanced metastatic breast cancer. And so he came into the clinic and they said, you know, Dr. Hayworth is in San Diego, but come into this room, she would be happy to see you. And at first he was a little bit skeptical. He said, what do you mean I'm seeing a virtual doctor? But when he came in, we both realized that we had a really close and human connection, and he was able to open up to me about the struggles that he'd been having with managing the health of his sick wife. Being not very healthy himself, that was a challenge. And to be able to discuss the challenges that he faced, and to be able to look at his wound and prescribe a new course of antibiotics, and to be able to do that all virtually was a really wonderful experience, and speaks to the power of telehealth to help and assist in the moment of a disaster or an emergency. And I actually followed up with him yesterday, a week after I saw him, and he was thrilled to be able to speak to me. It was like I was speaking to any one patient in my existing panel who I know personally, who I've met face to face, and I asked him, how's your foot feeling? And he told me for the first time in weeks he was actually able to walk on his foot. And he said that the toe that was previously red and swollen was now much less so, and he was able to get up and about. He was excited to be able to walk, and his wife had her first chemotherapy since the storm, and he had been able to take her to that and felt very good about his ability to provide that care for her. To be 1,000 miles from this patient and to feel like I'm in the room with him is a really powerful experience. And to be honest, it's not an experience I think I could have predicted I would feel until the moment of being on camera with the veteran in the room. I think once providers try this technology and when they see the effect it can have, and for myself to be able to really retain that emotional relationship with the patient has been the most meaningful.